A couple weeks ago, one late afternoon, I had severe abdomen pain. And what I didn't know is that I was going to be in for a long night of tests, ambulance rides, and morphine. You see, there is little known about the appendix and what it actually does for the body. But it can be very dangerous, especially if it ruptures. See, not a lot of people know the symptoms or the severity of appendicitis. And that's what I want to shed some light on today, is the symptoms and what you can expect if you have appendicitis. The appendix is a small finger-shaped pouch in the lower right side of your abdomen connected to your colon. Mayo Clinic states that the cause of appendicitis is a blockage of the lining of the appendix, and it causes infection. Once the appendix is infected, it becomes inflamed, and this is when symptoms will begin. Some of the first symptoms you can expect is some minor pain or a loss of appetite. See, WebMD states that the usual first sign of appendicitis is pain in the abdomen, but for me it was the loss of appetite. The day of my quote-unquote attack, I lost my appetite at lunch. I wasn't able to complete my full meal, and it was really shocking to me. And then later on, the pain started. You can expect the pain to start out as mild, something that you may expect to be like a stomach ache or you just need to go to the bathroom. But with time, it will get worse, a lot worse. Once you start seeing these symptoms, you need to get medical help. Once in the care of medical professionals, these are the next steps you can expect to be taken. First, they'll give you morphine for your pain. When I say the pain was so bad, I wasn't able to walk. That's how bad it was. After some of the pain has subsided thanks to the morphine, you can expect the doctor to do a pressure test. They'll start poking your belly and seeing where the pain originates from. If it's appendicitis, you can expect a lot of pain when they put pressure on the lower right part of your abdomen. The next step will be a CAT scan. The CAT scan will make it 100% certain if it's appendicitis or something else. Once the CAT scan comes back and it is clear that you have appendicitis, the next step is surgery and getting to your surgeon. For me, I was taken to my surgeon through an ambulance. Surgery can happen in a matter of hours. I was diagnosed about 7:30 p.m. that night, and then surgery was about at 11:30 p.m. It's that quick. The appendicitis is removed through a surgery called laparoscopic appendectomy, which is a small scope is inserted and they remove it that way. You can expect 3 small incisions from 1/4 to 1/2 inch in size. After surgery recovery all depends on the patient and how well you do with pain and recovery. According to Hopkins Medicines, doctors look for these 3 things before releasing you from the hospital. They want to make sure you can walk, they want to make sure you can eat, and they want to make sure you can pass gas. Once you do these, you can expect to be released from the hospital. I was released the next day at 4 p.m. After returning home from the hospital, you can expect an adjusted life for 2 weeks. For the first few days, you can experience minor pain and some difficulty moving around a lot. But in about a week, you may feel at 100%, but I promise you you're not at 100%. Your body is still healing and you need to give yourself time. Don't try to do something you're not supposed to. After 2 weeks, you'll follow up with your surgeon, and if everything looks good and you're not in any pain, you can expect to be cleared and return to normal activities. I know this is a lot for a little organ that doesn't really do anything for us, but I will tell you that from my experience, I'm glad I never have to worry about it again because my appendix is removed. The pain is unreal. I've broken a bone before, and that pain doesn't add up to what I felt when my appendix was inflamed. I hope that through my speech, you learned a little bit about the appendix, about appendicitis, and what you could expect if you get appendicitis. Thank you.